What's up, guys? Welcome back to my channel. My name is Hayley and I am a nursing student. I actually just finished my second semester, so I am halfway done with my ADN degree, which I'm so excited about, and I literally can't believe it, honestly, that I'm already halfway done. It flew by. Everyone said that it would fly by, but it really, really did. So we just got our final grades posted, and I found out that I got a 95% in pharmacology, which I could not believe, but at the same time I could, because I know that I put a lot of hard work into this semester. And I know that pharmacology can be a really difficult subject for a lot of people. And so I figured that I would make a video today about some tips and tricks that I used to study and to help me retain the information in order to do really well on the test and ultimately pass the class with a 95%. I do want to start off this video with a little disclaimer though. Every nursing program is set up differently and run differently, and you have different tests and different questions, and professors explain information differently. So everything that worked for me may not necessarily work for you. I think it's really important to find what works for you the best, because everyone learns differently, and some things that worked for me might not work for you at all. There's no magic way to get an A in pharmacology. It is a lot of hard work, a lot of studying, and a lot of literally figuring out what works best for you to study and to memorize the information, because pharmacology is a lot of memorization. You do have to apply stuff as well, but the foundations of it is really just memorizing stuff about each drug, so that when you have a question about it, you can apply your knowledge in order to get the question correct. Pharmacology is a really tough subject. It can really easily become overwhelming if you don't manage your time properly or have good tactics to study. People have other stuff in their life going on, like kids and other classes and working and having a social life. I mean, that's all stuff that we all have going on as well. So it's really important to find a good balance between studying for pharmacology and maintaining your life. It has a lot of information, and most of it's really important, but the key word is most. Not everything is crucial to memorize about each drug, because once you're in the actual nursing force and you say get a drug that you have to administer to your patient and you know the important things about it, it can be a quick looking up of the other things that you need to know about the drug, like as in when to administer it and all that other kind of stuff. But it is really, really important that the important things about each drug, depending what it is, or these serious adverse effects that can occur. Okay, so I'm gonna go ahead and jump into some things that worked for me when I was studying for pharmacology. Again, these things may not work for you, but I recommend giving it a try, because there's a couple things that I didn't think I was going to like and then I ended up using to help me study. So I recommend at least trying it and deciding if it works for you or not after you give it a try. Okay, so the first thing I want to talk about is concept maps. You may have heard of people using concept maps for other subjects or for nursing. This is one of those things that I really didn't think was going to work for me, but it was required for my class. We got a grade on doing a couple concept maps, so I was forced to try it, and I'm really glad that my teacher made us do that, because it ended up being something that I really enjoyed using. It's a good visual of all the important things. And I can actually make another video for you guys if you want to see how I made these concept maps, but I'll give you a quick look at mine right now just to see what it looks like. Okay, so here's my concept map on anemia drugs. As you can see, I put a definition, and then I put just a little note about red blood cells. I put the definition and stuff of anemia. It's really important to have nursing implications as well as adverse effects. I put this about pediatric dust poisoning, because that's really important to know as well. And then up here I have the adverse effects and some information about epigen. You can really set them up however you want. I'll flip to the next one. This one's about parental nutrition. This one's a little bit easier to read, because as you can see, I just include the important information. So again, nursing implications, adverse effects, indications, those are things that you should have on every single one. Here's pituitary drugs. I have the different types and each there. And yeah, so again, nursing implications, that's like one of the biggest things you want to make sure that you include. Again, I'm not going to spend too much time on those because I am planning on making a whole separate video about concept maps, but I definitely recommend trying those, especially if you're a visual learner. That's like exactly what you should be using to study because they'll help you a lot. Okay, so the next thing that I want to talk about is note cards, because I mentioned these in my last video. These are regular size note cards, and these are the big 4x6 that I mentioned in my last video. I like these better just because you can fit a lot more information on it. So basically with those, I put the same kind of information that I just mentioned on my concept maps. It's really important to have the drug trade name as well as the generic name, indications, adverse effects versus side effects, because there are some things that are expected normal reactions as well as things that could be life-threatening or that are abnormal. So you want to make sure that you know that kind of stuff. You also need to know patient teaching and nursing implications that are super important for each drug class. So what I use to make my note cards is this Davis Drug Guide for Nurses. I mentioned it in my last video. Again, so if you don't have to get this for your school, I recommend getting it because the way that the book is set up, it has all of the information that you'll need to put on your note cards or on your concept map. So this is where I get all my information from to decide what's important to put on those note cards. The biggest tip that I have with this is that when you are looking at the adverse effects, definitely make sure that you write down the stuff that is red and underlined or bolded or whatever, because those are the most important life-threatening ones that you're definitely going to need to know. There's usually a lot of other like side effects that happen with like almost every drug. So those ones are less important, but make sure that you focus on the ones that are underlined and bold and in red. The other tool that I found super helpful for studying was my whiteboard. I mentioned this in my last video also, but this is super helpful for writing stuff out and testing your memory, and then you can just erase it right after and just compare it to see how you did. I use this a lot of the time when I was studying. So the next helpful hint that I have for you guys that will work pretty much for anyone is to focus on the stuff that your teacher points out during lecture. You know, make sure that you highlight or underline that kind of stuff, because usually when your teacher is pointing that kind of stuff out, it's going to be on your test, or it's going to be super important for you to know in the future. This worked for me also because, again, like your teachers are trying to reinforce the knowledge that you need to know specific for each program. And that's kind of just like a trick of how to do better on the test, is to focus more on the stuff that your teacher specifically talks about, and a little bit less on the stuff that maybe they didn't go over very much, or if at all, you know. I just wanted to show you guys my notes really quick so you can see what I'm talking about. As you can see, like there's some notes that I added that weren't in my notes, and then also I underlined some stuff that my teacher pointed out that was important. So that's the kind of stuff that she did her tests on. See, I have some stuff written, and everything highlighted is like stuff that she pointed out that was important. And so yeah, that just helps you to kind of focus when you're studying. So like, see, she didn't talk about these slides really at all, so I didn't focus on that stuff too much, but everything highlighted was really important for me to study. I just wanted to add this little side note in there. When you're studying, it's literally impossible to remember every possible thing about every drug and to retain that information. So my biggest thing that I would recommend is to focus on the life-threatening adverse effects, and then if there's anything else that's like specifically important for the drug, like to not take during pregnancy, to like make sure that you take it with a meal or on an empty stomach, or that it needs to be taken at night, needs to be taken in the morning, that kind of stuff is really important, opposed to like all drugs need to be taken on a regular basis. You should not double dose if you miss doses. Like that kind of stuff is universal for like all drugs, so you should know that kind of stuff. But you don't need to remember that like specifically for each drug. So just remember the important things about each drug. Don't stress yourself out too much. Make sure that you are not cramming for tests, because I promise that cramming is never the answer. It does not work. You're not retaining the information. There's so many scientific studies done to prove that cramming doesn't work. I don't care who you are. If you think cramming is the best form of studying, I'm just going to have to disagree. You need to space out your time, even if it just means studying a little bit each day. your ability to retain that kind of information when you study like that is so much better. Or, you know, sit down and study for a period of time, take a break, whatever works for you, works for you. But I definitely think that cramming is, you're gonna get into the test and everything's gonna be mixing together in your head, and it's gonna be really hard to like pull that stuff out for the test. Okay guys, so to wrap up this video, I just want to remind you that pharmacology is not an easy subject. There's no easy way to just magically get an A. You're definitely gonna have to put in the work, put in the time and the studying, and finding what kind of study habits work the best for you is literally the most important thing in nursing school in general. I recommend doing this like before the semester even starts, because you really need to know what works for you in order to study and retain the information. It is possible to pass with a 95%. I am living, breathing proof of that, and I didn't do anything spectacular, I promise you guys. So if you find what studying habits work for you, you can pass with a 95% too. Thank you guys for watching. I hope you enjoyed, and I hope that some of these tips will be helpful for you. Make sure that you subscribe. I do have some more videos planned in the future that I'm going to put together for you guys, so make sure you subscribe to watch out for those in the future. Happy studying!